Now, if somebody wants to get upper and lower teeth that don't come out, or upper and lower teeth that snap in, snap out, what are the dental implant options? Like, how many implants does it take? You could kind of go over that.
Yep, so there's options where you can have 2 to 4 implants placed that a denture will snap into. I don't like that option though.
Why don't you like it?
Because patients don't like it. Patients that have it done, they think it's gonna be a solve-all. They think they're gonna be able to eat and chew all the things they want. They can't. This is something that's made of acrylic or plastic. It breaks, it fails. They don't get their full chewing ability back. And so you have unhappy patients.
Is there out-of-pocket expenses?
Most of the time at offices that do these, you have to pay to have this fixed. It's a constant investment. You're constantly having to make it.
But it's cheaper at the beginning.
It's cheaper at the beginning. There's been a lot of studies done that show it ends up being the same, if not more expensive over the long term because of all the repairs and all the chair time. It's still a denture, just snapping into a couple implants.
Why is it the new guys, especially here in California, they do these snap-in dentures?
You know, it's a less technical procedure, and so doctors think it's easier. It's something that they can do. I'd challenge any of them after they've had 50 of these patients with these snap-in dentures if they still would want to do them, because they're going to have 50 patients that are unhappy. And we want our patients to be happy. We want them to not have to worry about dental problems anymore. That's what brought them in. Years and years of dealing with these dental issues. We want to start with a clean slate, give them a solution that's permanent and last forever.
So teeth that don't come out.
And don't come out. Something that'll last them for the rest of their life, no issues. The next level up is what everyone wants. It's the permanent teeth that don't come out.
Okay.
And
how many implants for that?
Yep, with as few as 4 implants on both top and bottom jaws, we're able to deliver a permanent set of teeth that doesn't come out, that allows them to eat and chew everything they could possibly want. They could chew on rocks if they wanted to. These things are so durable. And the benefit is this material that we use, it's the best looking material. So it gives them the absolute best looking smile they could have.
Now, we were talking in the green room earlier because we did some looking. You're about 30% less with your getting an upper and lower set of teeth that don't come out on implants. You're about 30% less than the national average.
Yep.
And I looked at really low prices online. And as you pointed out, those are just snap-in dentures.
That's exactly right.
So is there a lot of that, like on Google, very confusing because it looks it's cheaper, but it's just snap-in teeth?
It can be confusing for me as a doctor. I imagine it's even more confusing for patients to understand what it is exactly that's being advertised.
You think it's misleading, like to say, hey, you're getting new teeth. They think it's teeth that don't come out, but it's just a denture.
There are definitely ads out there that are misleading, and it makes you wonder if the first thing you see is misleading, what else is gonna become an issue and be misleading? And so we pride ourselves in doing it right, in doing it one time, and giving patients a solution that lasts for the rest of their life. No small print, everything's all included, and this is a way for a patient to really get back what they've been missing.
Now, what if you don't have enough bone? For example, if you've been wearing a denture for 20 years, I guess you don't have enough bone to do this.
That's not correct. That's what patients have been told time and time again at locations that don't have the training or the specialists to do this.
Okay.
As specialists, we have a bit of an unfair advantage where we've been trained in this. We have 10,000 cases under our belt, and we know how to treat these patients with little to minimal bone and still give them the same result.
Do you hear that like I was told I didn't have enough bone?
Every day, and there's a lot of offices that know that we have the specialists that can handle this, and they refer patients to us because they know we can manage patients with little bone. Patients sometimes have been to 10 different offices, been told no at every one. We have yet to turn a patient away. We had a lady come in just this last year. She had been in a denture for over 30 years. Over that time, you lose a lot of bone. She came in with very, very minimal bone. She thought there was no options. She was hopeless, desperate. We were able to give her a permanent set of teeth, both top and bottom, that is fixed, it stays in, allows her to eat and chew, and she had that done in one day.
You say there's less bone grafting than ever before. What do you mean?
Yeah, that's accurate. Because of the way that this process works now with our digital technology and being done in one day, we still may do some grafting, but it's in combination with the placement of the implants.
So it's done on the same day?
Same day. So we don't have to wait 6 months after grafting's done in order to place the implants.
That happens?
That happens every day at other offices that just don't have the specialists or the expertise.
So Yeah,
we do it all in one day. Implants go in. Sometimes grafting goes in at the same time, but patients are able to leave that same day with a set of teeth.
So no more dentures. Do you think this is the future of dentistry where, let's say 10, 20, 30, 40 years in the future, dentures as we know them won't exist? They'll all be attached to something? What's your take?
I'll tell you, I hope it is, because seeing what dentures have done to people and the limitations that they have, these patients are not happy. I've yet to meet a patient that is happy with their denture. They can't eat the things they want. They're embarrassed that it's going to fall out when they're with friends and family. It breaks constantly. We got to remember, it's just a piece of plastic. If we can make a shift as a dental community and make this the gold standard, we'll have happier patients, healthier patients, patients that are able to eat and chew the things they need to, and ultimately able to live their lives to the fullest.